Hey guys, Dr. Ray Marquez here, your local chiropractor at Back Pain Relief Center. Today I'm at my South Carolina office down in Murrells Inlet. This is our latest episode of Dr. Ray TV. Today we're going to talk a little bit about sciatica. And you know, when I come up with these things to talk about, I try to get as much feedback as I can from people on Facebook and Instagram and see what's bothering people. And someone who left a comment about one of my posts said that they had sciatica, so I'm just going to talk about it a little bit. And on that note, if you're watching this, if you feel like it helps you, or if you have more questions, make sure you Facebook me or Facebook message me because I reply to all of them, and maybe we can help. So number one, what is sciatica? Well, in the simplest term, sciatica is inflammation of the sciatic nerve. And the sciatic nerve is a big old nerve that goes down your legs, and it helps control the legs. It's made up of the 5 lumbar nerves that come out of your low back. So the 5 nerves come out of your low back and right kind of around your butt, they turn into one big nerve and they come down, and then that nerve branches off to different parts of the leg and it does certain things. Seems like a lot of people get it. So people can feel a bunch of different symptoms. They can feel an aching pain, they can feel a numbness or tingling, they could feel spasms, they could feel like it's just a tight muscle or tight hamstring. You know, I get it myself because I have a few problems in my low back, and for me it's not really pain, but it feels like I constantly need to stretch my one leg. So there's a bunch of different sensations that you can get. So it's important to find out what it is. This way we can get it corrected. So it can originate in kind of 2 different spots. Well, really more than that. We have 5 joints or 5 lumbar vertebrae, and they make up these different joints and nerves come out of them. So most of the time, or the majority of the time, one of those nerves, one or a few of those nerves, a few of those discs have herniated, bulged, or doing something, or pushing on the nerve root that turns into the sciatic nerve. So you can pinch a nerve in your low back, okay? And once you pinch in your low back, then it sends a signal down your leg. Now, most of the time when we get this, someone has already had back pain for a while. Maybe they ignored it. Maybe it comes, maybe it goes over the years, and then it slowly gets to this point where it's degenerated enough and there's a disc problem that's pushing on the nerve. And we'll talk a little more about that disc problem here in a second. So number one, it can be pinched in the low back or in the lumbar spine, shooting a signal, whether it's pain, tingling, aching down your leg. In some rarer cases, but we do see it once in a while, sometimes you get a thing called a peripheral nerve entrapment, where the muscles, say in your butt or your hamstrings or somewhere in your leg, have tightened or spasmed around the nerve and are irritating that nerve, making it inflame and causing pain. So you can have one or the other, or you can have both. So real important for that to get checked out. Let's go back to how it can pinch a nerve. So when we look at lumbar spine, we have these discs in between the joints, and they act as shock absorbers. And these shock absorbers can get damaged, or the joint can get damaged and become dysfunctional, and the disc dehydrates or gets thinner, and the inside squishy part of it pushes out. And when it pushes out, it can put pressure on one of the nerves. I think I got a message here while I was doing this. Hopefully everyone didn't see that. But anyway, and when that disc or the material from the disc either pushes out, whether it bulges or herniates and pushes on the nerve, it can send either pain in the back or pain down the leg. A lot of people get a similar thing in the base of their neck where the disc will compress, a lot of time from car accidents, put pressure on the nerve, and we can have tingling in the hands or pain down the arm. But when it's in our leg, we call it sciatica. So what needs to be done about this whole thing? So first and foremost, with sciatica, inflammation has to get down. The main problem is something's inflamed. The nerve's inflamed, the disc is inflamed, the muscles are inflamed. All these things are going on. We got to get that inflammation down. So number one, how do we do that? How do we get the inflammation down? We got to take pressure off the joint. So if it's coming from a pinched nerve in your low back, we got to take pressure off the joint. And we take that pressure off by using a spinal manipulation or cracking your back. And what that does is decompress the joint, allows part of that disc to push back a little bit, and hopefully take pressure off it, and that helps bring the inflammation down. So again, spinal manipulations, like we've talked in the past, they decompress the joint, so it functions properly, it increases range of motion, and it aids in decreasing inflammation. Okay? So we got to take the pressure off and get the inflammation down. What are other ways that we get the inflammation down in the back? Well, we can do some very simple conservative things, and that would be things like, let's ice our back 15 minutes, 2 or 3 times a day, getting the inflammation down. Let's use a TENS unit, and whether you get an over-the-counter TENS unit or you get one prescribed from us, where we use an electrical therapy on your back that blocks those pain signals and helps get inflammation down. If you have sciatica and we feel like there's some instability in your lumbar spine or in your pelvis, we're going to put a belt on you to stabilize the low back to give it a chance to heal. Another good thing that helps, or 2 more things that help, is BioFreeze, which is a topical analgesic, will help with the inflammatory process. And lots of success with cold laser when it comes to these things. So we have a cold laser that we use that we put right at the base of the spine where the nerve may be pinched and gets that inflammation down. So to review again, what do we do with sciatica? Number 1, the most important thing is to get inflammation down. And how we do that is spinal manipulations, home therapy such as ice, TENS units, belts, BioFreeze, and some cold laser. Now, if there's another opportunity where maybe that nerve or that sciatic nerve is being pinched outside of the lumbar spine, meaning maybe the glutes or your hamstrings or maybe your calves are tightening up around that muscle, what we need to do then is some myofascial work. And that's kind of some fancy words for just use some muscle work, stretch it out, get the trigger points to relax, increase the mobility of the muscles, and take pressure off the nerve that way. The last thing we would do, or in addition to all the other things we would do, we want to make sure the lumbar spine and the pelvis is functioning correctly. Again, spinal manipulations help that work. Here's the thing when it comes to back disorders, whether it's sciatica, which is pain going down your leg, or it's tingling in the fingers and pain down the arm, there's no golden egg. There's no quick treatment, say, hey, you come in one time and this is going to be behind you. Or it's not even, hey, let's give you 1 shot or give you some medication and it's gone. Neck and back problems tend to take a few weeks to subside, especially when it's gotten to the point where it's shooting pain down your leg or shooting pain down your arm. It's been there a while, and it may just take us just a few weeks to get you through it. That's why I say always be patient with it. Remember the fact that it probably took a long time to get that way, and it may just take just a little bit for us to get you back there. So everything we talked about so far is conservative chiropractic treatment, okay? I wish I could say that I helped everyone that I've seen, and throughout the years, I've helped many, and I think I've helped more than I didn't. But the ones that didn't respond to conservative chiropractic treatment may need further medical intervention. And what I would do is refer you out for an MRI first off. So an MRI is going to show us exactly what's going on in that back. It's going to show us the disc, the nerves, the muscles, see what we're dealing with. Are we dealing with a herniated disc? Are we dealing with degenerated joints? Are we dealing with an arthritic property? And we're going to see what's going on, and then we'll get you to the right medical professional, whether that be a pain management doctor, or whether it be your primary, or maybe if it's orthopedic. Typically what they do, and I've seen in the past, is they're going to give you some type of medication, whether it's a non-steroidal anti-inflammatory or a steroidal anti-inflammatory, muscle relaxers, things like that. So everything they do, again, trying to get the inflammation down. They may even want to do some injections in your back where they can put the medicine right on the bad spot, and hopefully that'd be enough to get you to feel better. Worst case scenario, say chiropractic care doesn't work. Conservative medical treatment doesn't work, so pain management, orthopedics don't work. Our last straw would be to have a surgical consultation. Now look, I've been doing this a long time, and I refer out to surgeons very sparingly, and I do believe they do a great job, and I do believe there's a time and place for it. But I think you should try absolutely everything before you get to that point. And I think they would tell you the same thing. My biggest piece of advice here is just be patient, go through the steps, and give us a little bit of time to get you to feel better. So again, sciatica is inflammation of the sciatic nerve or the nerve going down your leg. It can be affected in your low back or in the muscles outside of it. Spinal manipulative therapy or chiropractic adjustments or just cracking your back had found to be very safe, effective, and one of the #1 ways to relieve that pressure. All right, guys, if you have any questions about anything we talked about, please message me on Facebook. I respond to everyone. If you have a condition that you'd like me to talk about in the future, please let me know, and I'll make it one of our topics. If you don't want me to talk about it on Facebook, I won't. We can talk about it through messaging. Hope everyone is doing well and have a great day. Bye-bye.